Well, David, over the last several days, as you know, there's been a lot of back and forth between ONA and Providence. There were no mediation sessions this evening and nothing scheduled as of right now for tomorrow, though Providence says they continue to email proposals and ideas back and forth. 5,000 healthcare workers, including doctors and nurses at 14 Providence facilities, plan to walk out at 6 a.m. on Friday.
Providence patients are bracing for the largest ever strike of nurses and healthcare workers in Oregon's history. Also the state's very first to include doctors.
Providence could end this strike tomorrow by coming back to the bargaining table with our nearly 5,000 frontline caregivers and negotiating a fair contract, but they've refused to do that.
A Friday morning walkout over staffing levels, wage increases, and working conditions would affect more than a dozen hospitals and clinics throughout the state.
We're hopeful that we'll be able to come to an agreement because that's what's best for the community.
With Providence and the union at a stalemate, lawmakers have weighed in, encouraging both sides to reach a deal, and soon. In a letter provided by the Oregon Nurses Association to the Providence executive team, both the Oregon House Speaker and the Senate President wrote that such a disruption coming as a last resort to frontline workers who have been bargaining in good faith would have negative consequences for patients, caregivers, and Oregonians as a whole. They go on to urge the hospital system to re-engage in the bargaining process in good faith. On the federal level, Senators Ron Wyden and Jeff Merkley encouraged both sides to bargain in good faith. Senator Merkley said Oregon Nurses Association healthcare workers at Providence do life-saving work for our community and need safe staffing levels to provide quality care for patients. Providence told KGW Wednesday they've, quote, had productive conversations with a number of senior elected leaders and state officials. It is clear we share the same goals, ensuring Providence ministries can continue serving our communities and finding a quick resolution to these strikes.
Providence says all patients who have appointments or procedures delayed at the women's clinics or hospitals will be notified by phone a day or two before the appointment. Most routine appointments and outpatient surgeries, however, will be canceled. If you have questions, you're encouraged to call the individual clinic or hospital. David?
Yeah, counting down to Friday morning at 6 a.m. Thank you, Alma. Appreciate the update.